Chantel, tell us about this exciting new technology, the Scout Radar.
Yeah, so the Scout radar, Joe, uses an electromagnetic reflector, which is a small reflector that's placed into the tumour in the breast or the cancer in the breast. And then we use a laser probe, a laser light probe in the operating theatre to help us localise accurately that tumour. We can localise the tumour within a millimetre of its exact position.
And how important is it that you can pinpoint that tumour?
It is very important for two reasons, because we want to find the cancer, and particularly when they're very small, it can be like trying to find a needle in a haystack. But secondly, we want to be able to reduce the amount of healthy breast tissue that we take for the cosmetic outcome to improve cosmesis. So if we know exactly where it is, we can reduce the amount of tissue that we need to take.
What has been the procedure up until now?
Well, the mainstay procedure is a thing called hook-wire guided localisation, which, sounds slightly barbaric. The patient actually gets a little tiny wire, almost like a fishing wire, that gets placed into the breast. They need to go on the day of the procedure to have the wire put into the radiology department, and then they need to have a mammogram afterwards with the wire in, and then come back up to the operating theatre with the wire sitting in their breast. Go to the theatre, then we need to take the wire out. We use the wire almost like a road map to dissect down to find the problem. Take the specimen out with the wire, then that whole specimen needs to be sent off to the radiology department for an X-ray. And then you've got to wait for that to come back to know that you've got what you came for, and then it increases the operating duration for the patient and sometimes the amount of tissue taken as well. And patients find that procedure very stressful because, it's a difficult day for them. Sometimes it's like the worst day of their life, the day they have to have a breast cancer removed. And so to rush them down to the radiology suite, rush them back up, it adds a lot of stress for the patient, anxiety, and can be painful for them as well.
How will this new technology improve on the wire technology?
Firstly, productivity for the patient and for the theatre staff, because we're reducing the amount of time that the patient needs to be in the hospital, which means we can do more cases. It will reduce the amount of tissue that is required to be taken, and therefore will improve cosmesis, and it will improve accuracy in terms of us detecting the tumour within a millimetre of its position.
How many women have received this new technology in Australia?
In Victoria, 4 cases thus far. I did the first case in February this year on a lady that had a recurrent tumour sitting just underneath her collarbone between the pec muscles, pectoralis major and minor muscle. And if I had to use the hook wire technology, I wouldn't have been able to remove the tumour, because as soon as I dissected down, the muscle would have contracted and I wouldn't have been able to find. It was a 4 mm cancer. So it was fortuitous that we had that technology for this patient. Since then, in Sydney, they have done more than, I think, 20 cases, but we were the first in Australia to do that.
And how long before this becomes readily available for all women with breast cancer?
Well, we're hoping that now that we have the machine, that we'll be able to use it more frequently. About 70% of breast cancers are impalpable and will require something like the Scout or a hook wire to be used. And so we're hoping that about 70% of ladies will be able to utilise this technology.
And for someone such as yourself who's worked with breast cancer and women with breast cancer for some time, how exciting is it to see this kind of technology?
It's wonderful, because the most important day of the patient's cancer journey usually is their operating day. And that is a day that's very stressful. And so if we can do anything that is possible to reduce their time in the hospital and make that process easier for them, it will impact on their survival. I truly believe that.